the super disappointing news that we all got yesterday. Drew Brees' thumb injury, we learned today, courtesy of Adam Schefter, Ian Rappaport, others, that Brees likely going to need surgery on that thumb, likely out at least 6 weeks. Wanted to talk to a hand specialist. So Dr. Timothy Bowlin of the Baton Rouge Orthopaedic Clinic, good enough, hand and wrist specialist, good enough to join us here on the show. Doc, thanks so much for the time. How are you?
I'm well, Matt. How are you?
I'm fantastic. Now, I hope that we can speak in completely layman's terms because I'm an idiot when it comes to all things medical. So
Sure.
when we talk about a UCL, what make sense of this? What happened to Drew yesterday?
Well, he clearly sprained his thumb, and it's the joint where the thumb really meets the hand. And basically, there's a ligament on each side of most joints, much like the knee or the elbow. The thumb joint where he injured, it's very similar. So when you think about football players injuring their MCL or their LCL, it's an analogous ligament. And so on the inside part of the thumb, closest to your index finger, there's a ligament that stabilizes that joint. And when he hit the opponent, it torqued his thumb to the side away from his index finger and most likely tore that ligament.
So what does surgery then do for that ligament? Why not just let it heal over time?
Well, and somebody that's not a professional athlete, if it's not torn severely enough, you can let it heal in a cast or a brace with enough time. But somebody that depends upon their living with their hand, you want to go in and repair it, which then facilitates getting the movement back, the strength back faster.
So I very much believe in like an eye for an eye. So can we go to Aaron Donald and like cut off his thumb? Like, is that an agreeable punishment here?
I guess it could be in some people's eyes. It's probably not a good idea.
Yeah, I'm halfway kidding. I'm just really sour about this. So
I understand.
So all right, with a UCL tear or injury there, Drew said like he couldn't grip the football. What would be the most notable effect of that injury?
Well, Matt, let's say it was your thumb,
okay.
And you went to grasp, I don't know, a football, for example, anything that's large like that where you have to spread your thumb out really wide. Well, that ligament that he tore stabilizes that thumb to allow you to be able to grip against it, to push against it. If his is completely torn and he went to push against his thumb by gripping something wide like that, it's going to be unstable, and then his thumb's going to fall away from the football, which means he'll have very little strength when he goes to grip.
All right, let me ask another dumb question. Could you just give him an injection to numb it, and so then he doesn't have that pain?
No, because it's not just a pain issue. Even when the pain goes away, he has an unstable thumb, so he has basically no post to pinch a grip against. So there's nothing there holding it, providing resistance in order when you grab on something wide or you have to grip hard like a football.
Got it. A couple of more minutes here with Dr. Timothy Bowlin of the Baton Rouge Orthopaedic Clinic. He's a hand and wrist specialist. We're talking about Drew Brees' injury. You're doing an awesome job, by the way, of making this sound simple because I don't do science, and this is making a lot of sense to me. So, Drew, let's say Drew comes out of surgery. What's the rehab and recovery process from surgery?
Well, if it's done the way I fixed mine, which I'm sure it's going to be very similar to this, he'll have a soft cast on for 4 or 5 days probably. He'll see a therapist, and they'll start moving his thumb gently. And then around the 4-week mark, as long as everything goes well, he'll have a lot more stability, and then he'll probably be able to start doing some light throwing. Best case scenario is he could play again at 4 weeks, but most likely it's 6 weeks. It all really depends on the severity of his injury and how well the surgery goes.
Is a 6 week time frame to be back on the field? That sound realistic?
That's on the positive side of thinking. Sure, I think with a good repair, good rehab, I think he could probably be back on the field at 6 weeks. Could be 8 weeks, could be earlier, but 6 weeks is probably a good number.
The long tail of that, if it is 8 weeks, what would be an indicator that would suggest it would take longer?
I guess if he has more pain, he has less of a stable repair. Sometimes the ligament is not of great quality. If it got shredded, for example, during the injury, it may not have as great a healing potential. but I'd be willing to bet six weeks would probably be when he's back.
Is that would that be a pain tolerance issue at 6 weeks, or if the long tail that we just discussed, is that a pain tolerance, or is that just a functionality of the thumb issue?
It's both.
Okay.
And I bet Brees has a pretty high pain tolerance.
That was my hope.
Football player.
Right.
Yeah, I bet he does.
Right.
But it also depends on how well his recovery is going, and that's something you really can't predict. But all going well, 6 weeks, minimal pain, he'll probably be able to get back. But again, it could be 8 weeks. It's just hard to say.
Okay, last thing for you. If, let's say it goes well, 6 weeks, Drew's back there, would there be any lingering effects throughout the remainder of the season from that surgery?
It's possible. If he took a direct blow to where he had his surgery, could be some pain there. So he may have a tendency to drop the ball or something like that. But if he has a good recovery, it heals well, there have been a lot of people that have had very normal function and never really had much of a hitch after that.
Can I just give him my thumb? Like, would you do a thumb replacement and just give him mine? Can that work?
That would be great. It would be great, but it would probably take a lot longer recovery.
Oh. Well, you foiled my plan, Doc. I was kind of hoping. And then it would work for Drew, and I get to be a hero as well, and it'd be great. But nonetheless.
It would be. I know. Probably not a good idea, though.
Dr. Timothy Bowlin of the Baton Rouge Orthopaedic Clinic. He's a hand and wrist specialist there. Doc, I appreciate a couple of minutes of your time. That was really, really helpful. I think you probably made this clear for a lot of people who are trying to understand what Drew's going through. So thanks for the time today.
You're welcome, Matt. Have a great day.